Hey there, it's Christopher Westfall. I want to give you a couple of updates happening with Medicare. And sometimes, you know, that old adage is true. If you want something done right, you got to do it yourself. So today I'm going to talk about the Plan Finder tool if you're looking for your own Part D drug plan, whether you're turning 65, new to Medicare, or you're just in the annual enrollment period looking for a January new plan for next year. We've covered this before. It's critically important that you not rest on your laurels and just assume that the last plan that you had is going to roll over into the nice new plan of the new year. So many changes have been happening. People who had the placeholder plans, that's what I call the least expensive plan in the market because they take little or no drugs, are suddenly finding out when they open that notice of change that their cheap plan from last year is now going to be 5 times the price this year. Don't let that be you. I can't mention any names right here in this video. It's affecting a lot of people. Sometimes you may want to stay with that same company, but you have to find and change to another plan. So today I'm going to show you a way to make that a lot easier, and you can bypass some of the Plan Finder frustrations that are happening right now. And if you stick around to the end of this video, I want to get to some user comments and also reviewed a couple of people that are making big waves online with information about Medicare that's just not accurate. So again, I asked the question, who do you get your Medicare news from? So let's get right into it. A Medicare update about what's happening with the Plan Finder tool, Part D in particular. You've got to have a Part D plan if you have original Medicare or if you have a Medicare supplement. If you don't, you're subject to a 1% per month adding up accruing penalty until such time as you get a Part D drug plan. So if you've never had one, now's a good time to get one during the annual enrollment period. Whatever you sign up for before December 7th takes effect and goes into effect on January 1. You might seem to think, you know, it's really frustrating and very complicated to call Medicare at 1-800-633-4227, which is the phone number for Medicare. If you do want to call Medicare, make sure you call late at night because that's when their traffic is the slowest and millions of people are moving plans right now. But you don't have to call Medicare. You don't have to wait on hold at all. I'm going to show you a quick and easy tool that you could do it yourself. Find the least expensive plan that's available to you from a certain number of plans. We'll discuss that in just a minute. And bypass some of the frustration going on. So how are we going to do that? Let's get into it if this will move. Some of the things happening right now all over the news are the frustrations with the new Medicare Plan Finder tool. You may recall in October of 2019, they suddenly announced, hey, we're going to change this whole plan that we've been using for the last 10 years. We're going to revamp it. We're going to leave some things off. We're going to fix it as we go. It's like trying to work as a mechanic fixing a car as you're driving down the interstate. And yet that's what Medicare decided to do with the Plan Finder tool. It's been covered in the press everywhere about how frustrated people are. They're having problems getting things to come up right, whether it's the total out-of-pocket cost, mail order, their pharmacy showing up, the right benefits showing up. We get carrier notices a lot in the beginning of the annual enrollment period from carriers saying, our information's not right on the Plan Finder tool. We're trying to work with CMS to get this fixed. Right now it's not fixed. Call us directly or have your clients go to our website to compare our plans. Well, what if we don't want to do that? What if we want to have a simple way that you can compare some plans, look at the maximum out of pocket real easy, look at the star ratings of the plan, and in a very simple interface, compare, and how about this? Enroll in a plan without having to talk to a salesperson. Shudder the thought. And without having to wait for an appointment for our Part D specialists that work in here by going over your drugs. Do you want a way where you can do it yourself? Yes. Okay, I made that way. So here we are. We're going to show you what this tool is. This is not the Plan Finder tool. All the data comes from the Plan Finder tool, however. We in my office have chosen, executive decision, not to use every Part D drug plan in the country. Not every one. That goes through the typical vetting process that we use to select a carrier based on a lot of criteria, length of time in the market, user satisfaction, our own reviews from people, talking to other industry experts, other agency leaders, finding out who is good to deal with as our level and who's not. Who do we want to field customer service questions, problems, frustrations from, and who would we rather not based on those experiences? So I'm going to tell you the caveat is using our tool that I'm about to show you right here. It's not going to show you every plan in the country. First of all, it's not going to show you plans outside of the states where we serve, and that's 46 states right now. It's the majority of the whole country. We don't do Washington, D.C., we don't do Alaska, we don't do Hawaii, I'll just tell you right now. We also don't do Massachusetts. But for most everywhere else, you can go to this tool that we have. I'm going to give you a very simple URL, and you can see it in such a clean, easy interface. I think you'll see that it's very refreshing. I'm going to show you part of that here in a minute. So I made a URL, a website address for this that you can remember easy. Maybe write this down. Maybe share this with some friends that can't get someone on the phone. We had a client in here today that came from Mount Pleasant. We see about 1 or 2 clients a year. All the other thousands of clients are scattered around the country, but this beautiful, wonderful lady, Miss Barbara, came over to see us from Mount Pleasant today. And when she came in, we got to go through everything with her, but she is with the AT&T retirees group. We had a lot of these retirees. I did videos about what was going on with the AT&T retirees where they're moving them off of their plan. Long story short, they must use Aon, the specific one call center for all of their Part D enrollments. They have to, otherwise they won't get the reimbursement money. And this may be true also for UPS, IBM, a whole bunch of big companies that laid off their benefits for the retirees and sent them into the market. Well, if you have to call one of these call centers like we did with her today, their recording said everybody's too busy, you're going to have to leave a message, you're going to have to make an appointment, and I understand that because everybody right now wants to change their plans. Bypass all that, get the information that you want, and if you can enroll right away without the frustration and confusion of waiting for an appointment or sitting on hold. So I made this URL called startpartd.com where you can shop and compare plans. I'm going to jump into that tool right now, show you some of it. Now, since this is a public video, I can't show you company names and I can't show you benefits because those are location specific. But you can look at this in 2 ways. One, jump right into the plans, go right where it says go directly into plans. That is quick as it could be. If you're looking for the least expensive plan in the market of the companies that we've chosen to represent, click that right there, go directly to plans, and boom, you'll see it. Least expensive plan right there at the top. No sorting, no muss, no fuss. A button there to enroll. You click the enrollment button, put your information in there, and guess what? It's done. That's all there is to it. You get a confirmation by email, you get an ID card in the mail, everything's done. Of course, there's no qualification for a Part D drug plan. It's just issued when you choose to do that. So the other one is, if you go through the getting started part, that's where you can put in your drugs. If you've got 15 drugs or 12 drugs and you want to see how do the companies compare all of these drugs, first, right out of the gate by lowest possible total out-of-pocket cost. Remember, the total out-of-pocket cost factors in everything having to do with what's going to really affect your wallet. The monthly premium, small part, the deductible on the tiers of your drugs you're going to have, which is pretty important because some drugs don't even trigger the deductible in most plans. And then the copay at the point of service, at the counter, how's that going to affect you and your drugs? Are you going to enter the donut hole, which yes, still exists? Are you going to get into the catastrophic phase? All of that is tallied together on this site and automatically shown from top to bottom, the least expensive plan to the most expensive plan. You could choose to, I'll just jump into the tool and let me just show you what I'm talking about. All right, I'm just going to jump into my internet browser here and I'm going to go to the top address bar and I'm going to type in startpartd.com. Don't type it into a search engine, just type it into the actual address bar at the very top. If you wish to use www, you could, but you don't have to. This is going to take us to our site. You'll see my contact information at the top, but you don't need to contact us. Again, you can do this directly if you wish. Let's say you just turned 65, you're new to Medicare, or you got to pick a drug plan and you don't take many drugs. You don't need to look at an analysis of total out-of-pocket costs because you take nothing or what you take is generic. You just want the least expensive drug plan and you want to sign up for it in less than 5 minutes without any fuss. Then you go to option 1, which I call option 1, go directly to plans. Let's do that. Go directly to plans is going to ask you where are you in the world because all the plans are specific. Going to put my zip code in here, hit submit. It's going to show you the local things available to you. On this tool, you could, hypothetically speaking, sign up for a Medicare Advantage plan. You could also sign up for a Part D drug plan. That's what we're going to do. We're going to do Part D drug plan, prescription drug plan. So click on this tab right here. We're going to see all these plans sorted by total out-of-pocket costs and monthly premium. See on the top here, the total is out-of-pocket costs. And if you have no drugs entered in there, then all your total out-of-pocket cost is going to be is the monthly premium. If you put your drugs in, which you still can do at this moment, then you can see what the estimated total out-of-pocket cost is going to be later. So let's just say this is the cheapest plan. It's $13.20 for whatever this plan is that I'm not allowed to show you right now. Or you could go up here and you could search for, I want to look for lowest plan premium, which again, if you don't have drugs in there, it's already sorting by that. If you do have drugs in there, you could sort by that, but it's not a good thing to sort by. Look at the total. But you could look at the star ratings of these plans. Star ratings are based on, what was it, 53 different criteria that they sort through, not the least of which is how easy is it to get appeals done if needed, to get exceptions if needed, and the customer service on the back end. So you could choose to go with a plan with the least amount of problems over time, been around for a while, but you're going to pay probably some higher monthly premiums for that, again, depending on where you are. But default, out of the gate, what it should be, like Plan Finder used to be, total out-of-pocket cost. Then you could click right here, and you could click on Add to Cart. You go to Enroll, and boy, oh boy, is it just that easy. You will now be directed to the carrier site to finish your enrollment. And it's already halfway there. It knows what plan you just picked. It knows where you are. It knows all that stuff. And you just simply jump right into the enrollment and it's done. So let's do a different one. Let's go to startpartd.com. And let's say you want to put some drugs in. So now we're going to go the other route. You could save all your information and come back to it later if you want to, create an account and all that kind of stuff, but you don't have to. So you can go here and start typing in your drugs. You can look at help me choose a plan. And then you put in your zip code. I want to look for drug coverage. It's going to ask you questions like, are you getting special assistance? Are you on Medicaid? Do you belong to a Medicare savings program? Do you get extra help? I don't know. Let's just do, I'm not eligible for any special assistance. Just a normal person going through. Now you start typing in your drugs. It's going to already grab your drug right when you're there. Look at your dosage. Look how fast that is. And let's add it. Let's say I'm going to take one of those cancer drugs that came generic, tamoxifen, right? So I'm going to add tamoxifen. I just start typing a couple of letters. That's all you have to do, and it'll find it. Which dosage are you taking and how many pills a month? I'll just leave this at 10 milligrams, 60 per month. Let me see if I can change that. Yes, I can. I can change my frequency and add it. Now it's going to be very accurate when it gets there. So let's do one more drug, and let's do, what's a cholesterol? Lipitor. Let's do Lipitor. Add Lipitor. Oh, do I want the brand name or do I want generic? And it's your choice, and it'll add up accordingly. I'm going to do generic 20 milligrams, one a day. Add that. Now I've got a running total of my drugs over here. Everything looks good. If it's not, I can change it or I can remove it. Now my drug list is complete. This is going to be my exact profile. Not really my exact profile, but it would be my exact profile. Now I can pick a pharmacy that I want to use. Let's say I want to use, let's say the Walmart pharmacy, although it probably wouldn't do that. But if I was going to use the Walmart pharmacy, I'm all done. I can pick multiple pharmacies, by the way, and compare the differences. I'm going to hit continue, go on through, and now I'm going to see an accurate quote based on out-of-pocket cost. And again, it's super cheap because I just got generic drugs, no big deal. Super low monthly premium in my area. Yours will be different. Every area is different. Remember that. And my total estimated cost. So if I pick the plan that's at the top, therefore recommended by the tool because it's sorted by lowest out-of-pocket cost, I can do that, or I can go down and pick another plan based on different criteria if I want. Maybe I heard that my neighbors love this plan and they like paying $77 a month for a 4-star plan, and they can do that, and your out-of-pocket cost will be a lot more. Whatever you want to do, it's up to you, but the enrollment process is so easy after this. So you pick your plan, and this is going to replace the plan that I'd already picked before. Wow, it's that smart, it knows it, even though I'm in incognito mode. I go to enroll in the plan, and it already takes me to the halfway point in the plan, already ready to go and finish the enrollment, not start from scratch, not call a number and wait on hold, get a scope of appointment sent back and forth, which is what you have to do if you deal with an agent, and then explain all the plans, download the documents, all that kind of stuff. That's available for you here. You can download the plan details. You can download the star ratings document. You can download all the stuff, or you can go right into the enrollment, and all your enrollment stuff is going to be sent to you at the home. I think this is a very quick and easy way for people that want to do it yourself. Get it done by December 7th, or if you're turning 65 any time of the year, get it done while you still can. Submit that and get it over with without having to deal with a person on the phone, But remember this, and I've said this a million times, please remind anybody else signing up for a Part D drug plan, expect the sales pitch. Expect the sales pitch from the company. We had one today, person signed up for can't mention the name, signed up for a Part D drug plan. It was not 2 hours later that they called her and said, you can get on our 0 premium drug plan. And by the way, it comes with all these extra benefits with it. No details about the plan, that it's Medicare Advantage, and they're giving up their original Medicare to get onto the Medicare Advantage and all that. So just be careful. Understand that you will generate a sales pitch if the company you're signing up for also has a Medicare Advantage plan. It's just what they do. It's just how the industry works. Expect the sales pitch and don't fall for it. Because if you're getting on the Medicare Advantage plan, that is not the same rules as Part B. We'll get into that later. But anyway, this is a super easy tool. Please share it with anybody that you like, that you want to share something good with, that they can get this Part D thing done without having to wait, and you can do it yourself in minutes with no fuss, no muss, no permission slips back and forth, no enrollment documents to have to sign and send back in, just online, real quick and easy. And rounding out the news from around the country, today there's a new video from someone who doesn't know what they're talking about with regard to Medicare, and they get the live spot on the Channel 8 News. Let's see what this financial planner has to know about Medicare and whether it's right or not. Let's fact check it. I want to skip ahead to this one part.
Concerning Medicare, right?
That's right. That's right. Medicare is health insurance for people age 65 or older, or if you're under the age of 65 and on disability, then you can qualify for Medicare.
So taking that a little
If you
further,
have to
when
read
can
that,
someone
then
enroll in Medicare exactly?
Well, you can enroll in Medicare up to 7 months before your 65th birthday. If you do not enroll by age 65, you will be charged a penalty. So you want to make sure that you enroll on
Wow.
time.
What did she say again?
Then you can qualify for Medicare.
So taking that a little further, when can someone enroll in Medicare exactly?
Well, you can enroll in Medicare up to 7 months before your 65th birthday. If you do not enroll by age 65, you will be charged a penalty. So you want to make sure that you enroll on time, and if you're not drawing Social Security.
Oh my gosh, folks. Okay, so she said you have to enroll, and you can enroll 7 months before your 65th birthday. If you don't enroll by your 65th birthday, you're going to have a penalty, right? Let's look at that. Police are chasing somebody outside. That's North Charleston, South Carolina for you. Oh, good. Wonder if they're in our parking lot. Oh my gosh. Okay, let's go look at Medicare. What does Medicare say about this? Part A and Part B sign-up periods, as indicated by Medicare.gov. They are the de facto standard for what is true and what is not true about Medicare. You can find this at Medicare.gov. Search for sign up and when to sign up. When to sign up for Medicare. When you're first eligible for Medicare, you have a 7-month enrollment period. A 7-month enrollment period is far different than the 7 months before you turn 65. Let me show you how that works. So let's look at what Medicare thinks is the 7-month window. It's not 7 months before your 65th birthday, that's for sure. So let's give an illustration here. I'm not a graphic design person, but I just put this on here. Let's say your birth month is June. You're born June 15th. That means, according to Medicare, you've got the 3 months before June, and you've got the 3 months after June, and you've got June itself. That is the 7-month window. You've got 3 before, the month of your birthday. That's the best time to start Medicare, by the way. Then you've got the 3 months after. By the way, if you wait until those 3 months after, it gets slightly complicated. Let me explain to you what I mean there. If you go on to Medicare.gov, type in when will my coverage start, they have this little chart here that says if you sign up for Part A, if you have to buy it, or Part B, in this month, that is the month you turn 65. You waited until the month you turn 65. We see this all the time. Then it will start 1 month after. So if your birth month is June, you waited till June, just didn't get around to it, and you're not drawing Social Security, so it didn't automatically start for you, then the earliest it's going to start is July. But let's say you waited until a month after your birth month. Let's say you waited till July. Well, then it won't start until August, 2 months later. Let's say you waited 2 months after you turned 65. You can still do it, without a penalty still, but you're going to have to wait 3 months after you sign up for it to actually kick in. So the best thing to do, go back to the illustration, the best thing possibly to do is to sign up for Part B if you're not going to draw Social Security, which most people are putting that off until their full retirement age now. Do it anytime within the 3 months before you have your birth month, the 3 months before. Don't wait until after, then it gets kind of goofy. Don't wait till the birth month, then it's kind of too late for it to happen that month anyway. Most people that I know really want the benefits of Medicare because it's great insurance. So here's one little thing that most people don't know. So this is for original Medicare, Part A, Part B, and you can get your Part D drug plan in this timeline too. Even though you can sign up 3 months before you turn 65, it's only going to start on the first of your birth month, unless you were born on the first of the month, and then it's going to start a month earlier. But you can sign up 3 months before. That doesn't mean it's going to start any sooner than the first of your birth month. Anytime in this 3 month period, that's when you should sign up for Part B. Let's say you deferred Part B because you're working for a large employer group, which you can do. If your employer is more than 20 lives, then Medicare's secondary anyway, and getting Part B is totally optional. You can opt out of it because you have creditable coverage through work. What happens in that case is when and if you do decide to get on Part B later, let's say you're going to leave there finally, or you're going to take advantage of your Medicare because you just decided it's better, you can do that going forward. But the best thing to do is you got to get this employer form from Social Security, and the employer then, the HR people typically, have to sign and validate the fact that you had guaranteed coverage. It was creditable coverage this whole entire time since you were 65 and first eligible for Medicare. If you don't do that, you will have a Part B penalty, and you can't just sign up anytime you want to. If you do fill out that paperwork, it's no problem at all. You can defer Medicare if you want to. That's a conversation you should have with a trusted agent to figure out which is better in your case. Should you stay on the employer plan? Should you go on Medicare? It's a conversation we have every day. The interesting part here is, while these are the 7 months that real Medicare has, and not what the certified financial planner lady thought was 6 months before your birthday, it's not. You go to Medicare 4 months before your birthday, they're going to laugh you right out of there. Go to the Social Security office and say, this financial planner on TV on Channel 8 said I can come in here 6 months before my birth month and I could just sign up for Medicare. No, you can't. 3 months before, month of, 3 months after. Here's the interesting part in our Medicare Supplement world. Medicare Supplement open enrollment is different than original Medicare. You can sign up for a Medicare Supplement. Again, it's not going to start any sooner. The benefits are twofold though. You can sign up for a Medicare Supplement 6 months before your birth month. And you'll say, I don't even have a Medicare card at that point. That doesn't matter. You don't need one to sign up for Medicare Supplement with most all carriers. A couple of them give you a hard time. But typically you don't need a Medicare Supplement card or number from Medicare yet before you can secure a rate. And that's the key. You can secure a rate that will go into effect on your birth month 6 months before your birth month. What's the advantage of doing that? Sometimes these companies go up by 50 cents or $1 every quarter, whatever it is. They have a slight rate increase. You don't participate in the rate increase if you locked in, let's say, today's rate for an effective date that starts 6 months from now. And it gets even better. Let's say, for instance, we were talking about this person, birth month of June, right? So January 1, we can look at the rates for this person now. We're within 6 months now. I can write a June 1 effective date anytime I want to in January, and that gives the benefit of locking in a January rate for when that plan kicks in June 1st. Now, in our office, we remind everybody, if we're doing this early bird thing, we remind them within 3 months of their birth month, you need to go sign up for Part B if you haven't done so already, so that they know they still got to go through Medicare, Social Security, sign up for Part B to start on their birth month. But the Medicare Supplement, locking it in 6 months before, has a double whammy effect to it. Not only do you lock in January's rate in my example, but most of the Medicare Supplement companies we deal with lock in the rate for 1 full year. So let's say in January, I wrote somebody for a June 1st effective date. That doesn't mean they start paying premiums right now. It means we take the application and typically we'll secure 1 month worth of premium so that they can generate everything, hold the place and everything, lock it in, right? So their regular monthly drafts won't start until a month later, but the coverage will start June 1st. Why? Because when we made the application to them, they'll draft 1 month to lock in that plan, lock in that rate, issue the ID cards, issue the policy. All that stuff starts as much as 6 months before the effective date. This is really neat because then the effective date starts a 12-month clock with, again, most all the carriers that we deal with. So this person could not even fathom a rate increase until June of the following year, 1 year from the date that the Medicare Supplement started. So in effect, you can, on a Medicare Supplement, we do this all the time. We can start in January, write the application, take one draft the company will do, and that plan cannot have a rate increase based on current company policy for 18 months. That's really cool. Some of our companies have no rate increase. Some have very, very small rate increases. Some actually go backwards and have rate decreases. But the point is, if you want to maximize your savings when you're first starting on a Medicare Supplement plan, you can write it up to 6 months before your birth month. It's not having anything to do with starting Part B of Medicare. This is just the supplement that can do this. It's a very unique thing to a supplement. And then today, for instance, I had a lady that exercised the other side of this pendulum. She was 6 months, almost 6 months past her Part B effective date and said, I want to get a Medicare Supplement. She had all kinds of health issues. She was in Florida, all kinds of health issues. Typically, we could not help. If she just, had been on Medicare for a long time, no open enrollment period, no special election period, no guarantee issue period, nothing, we have to ask, okay, do you have any illnesses going on, any sicknesses, any hospitalizations recently, all the health questions. And she would not have been able to qualify. But ask her what her Part B start date is. Started Part B 3 months ago. Well, guess what? In the Medicare Supplement world, that open enrollment lasts 6 months past your birth month. So I could go from a June 1st birthday person, June 15th birthday person, Part B started June 1st, and I can write that person in July, August, September, October, November, December 1. I can write that person for 6 more months using their personal Medicare Supplement open enrollment period. Same does not apply to Medicare Advantage, by the way. Medicare Advantage, you've got that 7-month window. Your birth month, 3 months before, 3 months after. The best time is to start it on the birth month. After 3 months out, you're not getting a Medicare Advantage plan. You have to wait until the annual enrollment period. Same thing with the Part D, drug plan. So you've got a finite period of time that extends past your birth month, only 3 months with Medicare Advantage. However, on the Medicare Supplement, when your Part B starts, we could write it 6 months before, we could write it 6 months after. And we have utilized that so many times with people who realize, oh my gosh, I need a Medicare Supplement plan. I've been, kicking around this Medicare that I've had now for 4 or 5 months. Man, we rush to those, and we've had a lot of those this month. People that say, I need a December 1st effective date right now. They've learned something in these videos, and they're like, let me lock that in while I have no health underwriting whatsoever. Find literally the best company, and that's what we do. We help them enroll for that plan. So I hope that's been of value too. I think it is, and especially if you have somebody telling you some different timelines that have absolutely nothing to do with reality. You can double check that at Medicare.gov. You can probably find the right answer in our videos here, but man, who do you trust to get your Medicare news from? You got to be careful with these people on TV for some reason. And in the news again today, here's a sponsored segment about Medicare Advantage completely leaving out the world of Original Medicare, actually getting Original Medicare completely wrong again, and not mentioning the world of Medicare Supplements, all because it's a sponsored TV show. So I want you to help me here. Let's count how many times they say the word Advantage, and let's fact check them a little bit and see if what they're saying about Original Medicare and supplements are accurate. Let's go to a doctor that works for a Medicare Advantage.
Yeah.
Okay, so why should someone on Medicare join a Medicare Advantage plan?
Yeah, why should they?
There are a lot of benefits associated with it. Now, most people don't know that when you get Medicare, that only covers the hospital costs. There's Plan B, and you have...
Did you know that Original Medicare only covers the hospital? And Plan B covers the what? Plan B, that's Part B of Medicare. Let me help you, doctor. Part A is hospitalization. Part B is everything else. It's the outpatient side. Okay? It's not Medicare only covers hospital, and then you have to get a Plan B. A Plan B is a Medicare supplement that literally no one purchases. It would be nice if someone who's turned to as an expert that wears a lab coat on television to talk about Medicare would probably have a clue of the different parts about Medicare. But
now, most
no
people
such
don't
luck
know
here.
that when you get Medicare, that only covers the hospital costs. There's Plan B, and you're responsible for that. That's 20% of the bill. So you either have to get a supplemental insurance or you get what's referred to as a Medicare Advantage plan. That covers all that, and there's no extra charge for that.
That covers all that. Did you see how we just gloss over like a book this thick? It covers all that. That Medicare Advantage plan covers all that. Does it cover every hospital in America that accepts Medicare? Well, no. That Medicare Advantage plan, does it cover any specialist that I want to go to? No. Does it cover a specialist even inside your network without a referral? Well, no. Does it cover any surgery that I need to have right now, medically necessary surgery, or do I have to get pre-authorizations first? Well, that's not like original Medicare. Does it cover just all that? Is it just that simple to say that this Medicare Advantage plan just covers all that, just like original Medicare? Just like there are two clones, original Medicare, Medicare Advantage. Get all that, that's just nothing, and get all these awesome perks. Listen to this.
So you're getting tremendous benefit in addition to what we refer to as value-added benefits.
Oh, here we
whether
go.
it's glasses or hearing aids or a gym club membership, all kinds of benefits
All
that are
kinds
really
of
pretty
stuff.
amazing.
And so the Advantage plan, as far as cost, it doesn't cost more?
Does not cost you anything more. About 33% of people in the country decide to go on to the Medicare Advantage plan because of the benefits to it.
And so do just a lot of people, are they just not aware? Because if it doesn't cost more and they get so much more
They're
out
just
of
not
it.
aware?
I think people just don't know that it's there. And
They don't know it's
you know,
there. Yeah, it's only every 5 seconds on the television that it's there, with billions of dollars spent in advertising, blowing up every newscast out there. People just don't know that Medicare Advantage is there. How many times can we slip in the word advantage?
It's unfortunate because there's so much advantage to it. And there's the other advantage is that the doctors who take care of you,
Oh my gosh. Let's just leave out the details. Well, got one more for you. In crime fighting news, it's just the old cop of me, sorry. We have a video coming out of Claremont, Florida, talking about Medicare scam again. And one thing that it bears repeating, so bear with me. They're at it again,
Seniors.
folks.
Callers are contacting people wanting to talk about Medicare. They say they're affiliated with the Claremont County Senior Services.
Here's the point. When you take a phone call from someone, do not believe the caller ID. Do not believe that because the caller ID says that they are who they say they are, that you can trust just who the people are that say they are. I want to show you something from the Federal Trade Commission. If I can get to it here. We had a case a couple years ago. An insurance agent who literally had a fine of $82 million. $82 million. Why? Because he was, one, doing robocalling, but even more hideous than that, he was hiding who he was, using a fake caller ID so that people would answer the phone.
Mr. Russell was responsible for more than 200,000 robocalls a day, 21.5 million altogether. Now, like many for whom illegal robocalls are a business model, he sought to hide his tracks. He knowingly used unassigned phone numbers to display inaccurate caller ID information.
That's the point. Showed inaccurate caller ID information so they could make it up anything they want to on your phone. You've probably even received the phone calls that are your own phone number calling you from your own phone number. That's why it's important if you have voicemail on your phone, like your cell phone, make sure that you've set a PIN code on that even you calling your voicemail, you have to enter a PIN number. Why? Because crooks can fake that it's you calling your own number. And what does that do? Get you right into your voicemail, all your private information. So don't trust your caller ID, please. Make sure you spread the word. Scammers out there are continuing to do this, and they're calling seniors to say, I'm with the senior center. I need you to get your Medicare card number out. Give me your Medicare card number so we can update our records here. And that's how scams work. So I want to go over what we just covered today, okay? First of all, we talked about startpartd.com. You can look up your own drugs. You can look up the cheapest plans. You can look up the best plans based on your drug profile, and you can do your own simple enrollment there. It's going to save you lots of time. We talked about the Part A and Part B start dates of Medicare. It's not 7 months before You turn 65, like the financial planner said, it's 3 months before your birth month, actually your birth month, and then 3 months past that you can start with Social Security, who does it, start on Part B, if you so choose. If you're working at an employer group that's larger than 20 lives, that's optional for you. And those are things you need to consider. Things like your drug cost on your employer plan, your deductible, your monthly premium, those things have to be factored in. And then Medicare supplements, you can sign up for them literally 6 months before your Part B effective date, or 6 months after your Part B went into effect. That's still your Medicare supplement open enrollment period. If you've not yet done so, you need to take advantage of that. If you know someone who started on Medicare within the last 6 months, they may not know this because it's not publicized very much. Seems like all the media attention goes toward Medicare Advantage. I wonder why. Hey, I'm Chris Westfall. Thank you so much for watching. If this has been a benefit to you, please like the video, share it with somebody that you care about, and comment below and tell me what you think about it. Any questions that you'd like to see covered on future videos, please let me know. It's dark outside. It's about 8 o'clock. It's time to go home. Thank you so much for your patience when you're dealing with our office. We're getting through it now. We're getting back to the people who had called and left us messages through the craziest time of the year. We had some news publicity, which made the phones ring even more, but now we're at a manageable pace. Everybody's just cranking along, and we're really helping a lot of people. God bless you. Thank you so much for watching. Take care. Bye-bye. It's 6:30 at night, and my wife is still working. Hi, Nicole. What are you doing?
I'm going through people's files and sending them their scope of appointment for their appointments with Robert, especially our people who are coming off Medicare Advantage plans. We have to get them on the calendar before December 7th.
So we wrote them fully underwritten applications for January 1 start date because they want to
Right.
get off of Medicare Advantage. Now that they've been approved, we got to do their drug plan before December 7th, which kicks them off the Medicare Advantage automatically.
Yes.
Awesome. How many would you say have been in that kind of category so far?
Well, I've scheduled 12 appointments today from that list.
Cool.
I have about 15 more to call tomorrow. Well, some of them are still pending approval out of that 15. But yeah, we're
Was that
on-
Rochelle or Haley calling them and telling them they got approved? I bet they
Yes,
were relieved.
it's Rochelle's called a lot of people today. So.
That's so great.
Yeah, it's
Awesome.
been a very, very busy day. And I've been here since 8:30 this morning. You and I have been up since 1 and 2:30.
Yes, it's been a crazy day.
It's been a very, very long day.
But
it's
we have a
awesome.
short drive home, though, so it's no big deal.
Yeah, and I've talked to some really great people today. So today's been a great day.
That's
very
awesome.
happy.
We actually live 30 minutes away, and we both drove our own separate cars this morning. Been a long, long, long day.